Hi everyone, welcome back to Damal Consult Career Academy, your go-to channel for career success and interview mastery. In today's video, we're diving into the most commonly asked NHS Band 6 nurse interview questions. And I'll show you exactly how to answer them with confidence. Whether you're applying for a Band 6 position for the first time or aiming for a promotion, this video will help you stand out, impress the panel, and get hired. Make sure to watch to the end. I'll be sharing expert tips and real sample answers that will boost your chances of success. Let's get started. 1. What do you understand about the role of a Band 6 nurse, and how does it differ from a Band 5 role? The role of a Band 6 nurse carries increased responsibilities, leadership expectations, and a higher level of clinical autonomy compared to a Band 5 nurse. While a Band 5 nurse focuses on delivering direct patient care, maintaining clinical standards, and developing foundational nursing skills, a Band 6 nurse is expected to demonstrate enhanced clinical expertise, lead by example, and support the development of junior staff. As a Band 6 nurse, I understand that I would be expected to coordinate patient care more independently, make informed clinical decisions, and take on leadership responsibilities such as managing a shift, supervising junior colleagues and students, and contributing to service improvement initiatives. There is also a greater expectation to engage in clinical audits, mentoring, policy development, and ensuring adherence to governance and safeguarding protocols. Additionally, the Band 6 role involves acting as a role model, maintaining high standards of care, and often representing the team in multidisciplinary meetings. It requires a strong ability to prioritize, delegate appropriately, and resolve complex situations while supporting the team emotionally and professionally. In summary, the transition from Band 5 to Band 6 marks a shift from developing one's own clinical practice to supporting others, driving service improvement, and contributing to leadership and strategic aspects of patient care delivery. 2. Describe a time when you had to lead a team under pressure. How did you handle it? During my time as a senior staff nurse on a busy surgical ward, I was once placed in charge during a night shift where we faced an unexpected surge in post-operative admissions following a major trauma incident in the A&E department. Several patients were transferred to our ward in quick succession, many requiring complex wound management, high dependency care, and strict monitoring. At the same time, 2 staff nurses called in sick, leaving us short-staffed and increasing the pressure on the team. As the acting nurse in charge, I quickly assessed the acuity levels of the patients and reallocated staff based on their strengths and experience. I communicated clearly with my team, prioritizing high-risk patients and assigning tasks accordingly. I ensured breaks were managed fairly to prevent staff fatigue, and remained visible and approachable throughout the shift to support my colleagues emotionally and professionally. I also liaised closely with the site coordinator and the on-call manager to request a floating nurse for temporary cover and escalated where needed. Despite the intensity of the situation, I maintained a calm, solution-focused approach. I led by example, demonstrating urgency without panic, and made sure the team felt supported. At the end of the shift, we conducted a brief handover debrief to reflect on what went well and what could be improved. This experience reinforced the importance of clear communication, dynamic delegation, and leading with empathy in high-pressure situations. 3. How do you prioritize your workload when managing multiple patients with complex needs? As a Band 6 nurse, I understand that prioritization is critical, especially when managing patients with complex and varying needs. I use a structured and clinically informed approach based on patient acuity, safety, and urgency. At the beginning of my shift, I carry out a rapid assessment of all patients, review their care plans, check handover notes, and identify any immediate risks or changes in condition. I prioritize tasks using the ABCD approach and escalate concerns early if any patient presents signs of deterioration. I always ensure that time-sensitive interventions such as medication rounds, wound care, or critical monitoring are addressed first. I then balance other care needs based on clinical risk, patient comfort, and available support staff. Communication is key. I delegate appropriately to junior staff or healthcare assistants while maintaining oversight. And I work closely with the multidisciplinary team to coordinate care effectively. I regularly reassess priorities throughout the shift, especially if a patient's condition changes or if new admissions arise. Ultimately, my approach is guided by safe, evidence-based decision-making, clear communication, and maintaining patient dignity and quality of care, even under pressure. Before we proceed further in this video, if you're preparing for a Band 6 NHS interview, this is for you. We've put together an exclusive ebook titled 50 NHS Band 6 Interview Questions and Answers, packed with detailed sample responses and expert insights tailored specifically for NHS Band 6 roles. It's currently available at 70% off, so now's the perfect time to grab your copy. Click the sealer or fourth wall link in the description box below to download. It's very affordable. And there's more. If you want bonus interview tips, plus a free PDF with 10 extra interview questions and answers, just send us an email or a quick WhatsApp message. You can also join our WhatsApp group to connect with other candidates preparing for the same role. All the links and contact details are right below this video. To order now, simply visit Sealer.co using the link in the description, or click the fourth wall link. If you have any questions or need help, chat with our customer care rep on WhatsApp at 2,348,101,066,191 or send us an email at damelconsult08@gmail.com. Don't miss this opportunity. Get your copy today and ace your interview. 4. Tell us about a time you handled a conflict between colleagues or team members. During my time as a senior nurse, I experienced a situation where two of my team members had a disagreement over patient handover responsibilities. One felt that the other had not adequately updated the care plan, which caused a delay in administering medication. The tension between them began to affect communication on the ward. As the Band 6 nurse on duty, I knew it was important to address the conflict promptly before it escalated further. I asked both team members to step aside from the clinical area during a calm period, and invited them to a private space for a constructive conversation. I encouraged each person to share their concerns without interruption. Once both sides had been heard, I acknowledged the validity of their frustrations, but redirected the focus toward patient safety and teamwork, which are core values of our practice. We then worked together to agree on clearer communication during handovers, and implemented a quick checklist system to ensure that vital information was consistently transferred. I also reassured them both of my support and scheduled a short team reflection at the end of the shift to reinforce unity. By addressing the issue calmly, fairly, and quickly, we restored team morale and improved the handover process. This experience reinforced my belief in early intervention, active listening, and creating a psychologically safe environment where all team members feel respected and heard. 5. How do you ensure safe and effective delegation of duties to junior staff? As a Band 6 nurse, I understand that delegation is not just about assigning tasks, but about ensuring patient safety, staff competence, and quality care delivery. I follow the NMC code and the principles of accountability and supervision when delegating to junior staff. First, I assess the complexity of the task and match it with the skill level and competence of the staff member. I never delegate a responsibility that the person is not trained or confident to carry out. Before delegation, I give clear instructions, clarify expectations, and ensure the staff member understands what is required, including any risks or patient-specific needs. Throughout the task, I make myself available for support and supervision, especially if the junior staff member is new or unfamiliar with the assignment. I also follow up to evaluate the outcome of the delegated task and provide feedback or guidance where necessary. By maintaining open communication, promoting a supportive environment, and knowing my team's strengths and limitations, I ensure that delegation is both safe and empowering for staff development, while keeping patient safety at the core of every decision. 6. What experience do you have with audits, quality improvement, or clinical governance? In my current role as a senior nurse, I have been actively involved in several audits and quality improvement initiatives aimed at enhancing patient care and ensuring compliance with clinical governance standards. One notable experience was participating in a medication administration audit, where I worked alongside colleagues to review adherence to medication safety protocols. As part of the audit, I collected and analyzed data on drug chart accuracy, timing of administration, and documentation practices. From the findings, we identified gaps in documentation and implemented a new double-check system for high-risk medications, which significantly reduced errors. In addition to audits, I led a small quality improvement project focusing on reducing hospital-acquired pressure ulcers. I collaborated with the tissue viability team to introduce daily skin integrity assessments and implemented a color-coded risk charting tool at the bedside. This not only improved early detection, but also promoted staff accountability. As a result, our ward saw a 30% reduction in new pressure ulcer cases over a 3-month period. I also ensure that clinical governance is embedded in our day-to-day practice by supporting staff in incident reporting through Delegating, facilitating reflection sessions, and ensuring lessons learned are shared across the team. I regularly attend governance meetings and contribute to action plans developed from clinical incident reviews. These experiences have strengthened my understanding of how audits and governance frameworks directly impact patient safety, and have equipped me to support continuous improvement as a Band 6 nurse. 7. How do you support staff development and mentoring in your current role? In my current role, supporting staff development and mentoring is something I take very seriously, as I believe it directly impacts patient care and team performance. I regularly identify learning needs through one-on-one discussions, observations during clinical shifts, and team reflections. Once those needs are clear, I help set realistic development goals and signpost colleagues to relevant training, courses, and shadowing opportunities. I also take an active role in mentoring newly qualified nurses and junior staff. I ensure they are well oriented to our protocols and clinical systems, and I make myself approachable for both clinical guidance and emotional support. I encourage reflective practice by reviewing complex cases together and discussing what went well and what could be improved. Additionally, I help coordinate in-house training sessions and invite staff to participate in clinical audits and quality improvement projects, which boosts confidence and engagement. I keep a record of training attended and give constructive feedback that motivates growth. I've found that creating a supportive and open learning environment not only builds competence, but also strengthens team morale. 8. Tell me about a time you dealt with a complaint from a patient or relative. How did you resolve it? Yes, I recall a situation where a patient's daughter raised a concern about her mother not receiving her evening medication on time while on our ward. She felt that the delay reflected poor care and became visibly upset. I listened attentively, acknowledged her frustration, and calmly reassured her that I would look into the issue immediately. I checked the patient's medication chart and confirmed that there had been a short delay due to an emergency situation involving another patient that had briefly redirected our team's focus. I apologized sincerely for the delay and explained the situation without breaching confidentiality. I then administered the medication promptly, ensured her mother was comfortable, and took time to answer further questions from the daughter. To prevent recurrence, I escalated the issue during our handover and worked with the team to adjust the medication round timings slightly to improve efficiency. I also documented the incident accurately and informed the ward manager. By taking ownership, communicating clearly, and following up with actions, the relative felt reassured and appreciated the transparency. The situation reinforced my belief in early resolution, active listening, and the importance of patient-centered care in upholding trust within the NHS. 9. How do you stay up to date with evidence-based practice and changes in NHS policies or guidelines? As a Band 6 nurse, staying up to date with evidence-based practice and current NHS policies is a vital part of maintaining clinical excellence and providing safe, effective care. I make it a priority to regularly engage with trusted clinical resources such as the NICE guidelines, NHS England updates, and publications from the Royal College of Nursing. I subscribe to relevant clinical journals and newsletters, which allow me to track emerging trends, new treatments, and best practices within nursing and healthcare at large. In my current role, I also take part in regular CPD activities, internal training sessions, and clinical supervision. These forums provide an opportunity not just to learn, but to reflect on practice and apply the latest guidance within the team. I also use platforms like NHS Futures and eLearning for Healthcare ELF to access structured learning aligned with current NHS priorities. Beyond personal development, I actively promote knowledge sharing within my team. By discussing policy changes or new research in handovers or during team meetings. This ensures that updates are not just personal knowledge, but also part of our wider team culture. Overall, I see staying current as both a personal responsibility and a leadership duty, especially at Band 6 level, where clinical decision-making and setting standards is expected. 10. Why do you want this Band 6 position, and what can you bring to the team? I am applying for this Band 6 position because I feel ready to take on greater responsibility and contribute at a higher level within the team. Over the years, I have gained solid experience in clinical practice, leadership, and multidisciplinary collaboration. And I believe this role is the next natural step in my professional development. I am particularly drawn to this Band 6 role because it offers the opportunity to lead by example, support junior staff, influence patient care standards, and help shape service improvement initiatives. What I bring to the team includes a strong foundation in clinical skills, excellent communication abilities, and a proactive approach to problem solving. I am highly organized and dependable, and I have experience mentoring junior nurses and newly qualified staff, which I believe is crucial in a Band 6 role. I am also confident in coordinating care, handling complex patient cases, and remaining calm under pressure. Most importantly, I bring a patient-centered approach and a genuine commitment to upholding NHS values, improving outcomes, and supporting the team to deliver high-quality care at all times. Do you have any question for us? Yes, thank you. I do have a few questions. First, could you tell me more about the team I would be joining and how the Band 6 role contributes to its overall objectives? I'm particularly interested in understanding how leadership and mentorship are encouraged within the team, as I know that's a key responsibility at this level. Also, I'd like to know how the Trust supports ongoing professional development for Band 6 nurses. For example, are there opportunities for further training or courses, particularly in clinical leadership, patient safety, or service improvement? Lastly, what would success look like in this role over the first 6 to 12 months, and how is performance typically evaluated at Band 6 level? Thanks so much for watching. I hope these NHS Band 6 nurse interview questions and answers have helped you feel more confident and prepared. If you found this video useful, don't forget to like, share, and subscribe to Damal Consult Career Academy for more expert interview tips and career coaching content. Have a question or want us to cover a specific NHS role or healthcare interview? Drop it in the comments below. I'd love to hear from you. Good luck with your interview, and go get that Band 6 role. You've got this.